Greetings, everyone. We're excited to be on today. I have Dr. Matthew McNamee from Tiger Medical Institute with us. Hi, Dr. Matt.
Hey, Steve. How are you?
Good, good. Today, we're going to talk about a really interesting topic, and that is genetic testing. And, there's lots of different kinds of testing going on out there. And so what I want to do today in this video is talk about the difference from the kind of testing you might see on television as compared to the kind of testing that we do at Tiger Medical Institute. And then the second question I want to have Dr. Matt answer is just what is the impact of the kind of genetic testing that we do at Tiger Medical? What is the potential impact on you in working with a trained clinician who understands this level of genetic testing? So let's get started, Dr. Matt. You ready?
Sure, let's do it.
All right. So when you see things like 23andMe and other type programs on television or in like magazines, can you just kind of maybe give a little bit of a general overview? What is that kind of genetic testing directed at as compared to the kind of pretty advanced genetic testing that you're doing with the partner that we have?
Yeah, I mean, the first thing that comes to mind is you just said it, right? I think you're getting more broad strokes, really. So you will get, what these companies typically are showing, and it's similar with, so the companies I've either used in the past or now the ones that I use now is they're looking at these gene variants, right? And looking at maybe what sort of a association they might have with some sort of health condition or outcome down the road. But they, a lot of them kind of have like an overview of maybe some of the most well-known variants. We also call them SNPs. And they don't necessarily have, let's say, many of them, right? So I can think of even some of these companies, and they'll have, let's say, I don't know, a couple, maybe 1, 2, 3, actually just maybe even 1 or 2 on diabetes, right? Or I shouldn't even say diabetes, but specifically your propensity to potentially go down the diabetic pathways due to your genetics towards, how you, basically process insulin, blood sugars, all that stuff. So using that as an example, you get with this company, I mean, we have specifically panels that are that will have a plethora of different variants associated just with blood sugar levels.
Much more in depth.
Much more in depth. Yeah, yeah.
And also, if I recall, you also have evidence-based therapies based on each one of those that you can drill down into as part of that database that our partner provides.
Right. And using, I guess, diabetes or cardiac disease, any of these things, right? So they're complex chronic diseases. They are multifactorial, meaning there's multiple things that will contribute to that disease process, right? So when you look at the genes, you need to look at them together as well. So that's another kind of angle that you can look at when you're assessing this process. And then what, like you'd said, is what they do is they will, they'll utilize, right, the most recent evidence-based literature, all the stuff in the science that correlates with essentially optimizing, if we're trying to optimize pathways that are associated with a variant that basically would essentially normally produce a poorer health outcome, right? So how do we optimize that pathway so we don't end up in that same going down that trajectory? What's also unique, I mean, most places will basically give you your genes for poor outcomes, right? There's also the flip side. There are benefit variants. So look at the whole picture and you go, well, yeah, you've got 75% of these things are, would translate to poor blood sugar management, insulin resistance, prediabetes, all these things, right? But then you've got some benefits here, right? So how do we weigh that into the whole picture? So that's another, unique component as well.
And also everybody is completely unique in the weighting of that 75 versus 25, right? So you could have 5 different people that have a completely different mix, so you could potentially treat them. That's getting into our next question, but yeah. Well, good. So
yeah, I mean, this is really what makes I think this is really what makes precision medicine. I mean, you can look at everyone's, all these other biomarkers and everything, but I mean, when you look at someone's genetics, there's no 2 people that, for the most part, I mean, you can get twins, right? But no 2 people essentially, for the most part, clinically, I'll be working with are going to be alike, right? So using their genetics, it would be, creating a very personalized, approach for them. So,
and that really leads me to the second question is, kind of summarize what, because I know you're very excited about this. This has been a new development for us in the last 18 months. And, as a clinician who already does root cause type medicine rather than treating someone after they're sick, you're trying to get to things before they're sick. That's a big difference in what we do versus standard care. What does this afford you to be able to do as a clinician that you couldn't have done maybe 3 years ago?
Yeah, well, it helps me prioritize their overall, preventative or it could be preventative, it could be optimizing, it could be, actually try to tackle some of these things that they've already developed. It helps me prioritize some of these things because the genetics also come with, one, the prevalence in the population. So some individuals have some very unique things that could be in, less than 5-10% of the population, which typically, makes them that unique that it's probably contributing to their overall process, right? And condition. And then they also have the genetics listed out in odds ratios. So, what are the chances if you have this of developing diabetes, of developing atherosclerosis, of developing Alzheimer's, right? So it helps me prioritize all of the genetic information coupled with their family history, their concerns, their blood work, their other tests. And then we can really, really create a protocol that's super unique. And then we develop that as we continue to work together to see really what's working, what's not, what alternatives should we try to optimize some of these pathways, because there's a lot of options. I mean, not only, there's nutraceutical, supplement-based ones, some are pharmaceutical, some are nutrition, some are lifestyle, right? We have all these different ways of improving the outcomes based on the science that, it's that we have an order of, basically an approach on how we can offer these therapies and, reassess where they're at, and then have, alternatives to integrate if we're not getting the results we're looking for. So it's pretty cool.
And so at the end of the day, they're getting a one-of-a-kind treatment process, really, is what you're saying.
Big time.
Yeah, uniquely and specifically.
I don't have anybody on the same protocol, Yeah. You'll see some overlap occasionally with some genetic information, some of the stuff that we get back, you'll see some similarities.
Sure.
Everyone's really unique. Yeah.
Yeah. Good. Okay. Well, I hope this was helpful to everyone. I encourage you to go to our website, dig in more at tigermi.com. Go to the Learning Center and learn more. And if you want to take the next step in your journey, or go to our homepage and click on Schedule a Health Assessment, and you'll speak with one of our professionals who will help you understand if what we do is a good fit for you. Dr. Matt, thank you.